Hello and welcome to the Decipher podcast. I'm Dennis Fisher. With me today is my colleague Lindsey O'Donnell Welch. We're going to talk about this Change Healthcare attack, which happened, I think, 2 weeks ago today as we're speaking, Lindsey. And it's only gotten worse since then. It was pretty bad when it was first disclosed, but it seems like it's gotten like the impact and the fallout is really, really sort of spread in the 2 weeks since we first heard about it. I know you wrote the initial story for us, so maybe if you could just give us a little bit of background on what actually happened, and we'll talk about what's happened since then.
Yeah, thanks, Dennis. So on February 21st, that was when Change Healthcare first discovered a threat actor had gained access to one of its environments. And in order to kind of um, prevent further impact, it disconnected systems. And for those of you who don't know, Change Healthcare provides a number of solutions and applications for hospitals and pharmacies and just a very large amount of organizations across the healthcare industry. Related to payments and claims and imaging and pretty much anything you can really think of. So, as you mentioned, Dennis, there's been a kind of widespread disruption here. Providers, for instance, haven't been able to verify patients' health insurance coverage or their process claims or receive payments. And um, that's kind of trickling down to people not being able to pick up their prescriptions at pharmacies because claim systems are down or being impacted, or delays in scheduling care, paying bills, things like that.
Yeah.
So it's been disturbing to see this kind of spiral over the past 2 weeks. And I know the American Hospital Association is calling this one of the more significant and consequential cyber attacks in the U.S. healthcare system right now. So it's a pretty big, significant event.
I think I was trying to think about this morning. I think it's the most widespread one that I can think of in the healthcare industry specifically. And I think there's a number of reasons for that. One is just the effect it had on change itself internally. It was a ransomware attack. I don't know if we said that, but by the BlackCat slash Alfie group, which we'll get to later. But it was a ransomware attack, but they also stole patient data, as a lot of these, kind of double extortion intrusions happen. And it seems like it had such a widespread effect internally. Like they're rebuilding their data centers and databases and all of that. And as you said, they severed connections from a lot of their systems, which are obviously very drastic uh, actions to take. You don't usually see those sometimes you'll see people take systems offline that were hit with ransomware so they can rebuild them or things like that, but not to this level. And we were talking earlier about how neither one of us had really heard of Change Healthcare before this attack happened, which, I think it just goes to the point of this is one of those companies, and I can think of a few other intrusions like this, like SolarWinds comes to mind, some of those other supply chain attacks where you're like, well, wait a second, I've never heard of this company, but literally everyone uses them. Like the entire healthcare system depends on this one company.
Yeah.
And now we're seeing this cascading waterfall effect where doctors' offices, hospitals can't get paid. Insurance companies can't process claims. It's this real sort of chain of events that has really sort of disrupted the entire healthcare system in the US, honestly.
Yeah, that's a good point. I think it's interesting too because, I was thinking also about like, there have been a lot of ransomware attacks against hospitals and
Yeah.
we've been tracking those because it is so disturbing, like the impact that has on patient care and potential like appointments being delayed. But to your point, this is such a widespread thing that it's really just across the board there, and it's almost like a like in the same category as like a colonial pipeline in that you can like see kind of the face of you can see the picture of that's of the impact that's really happening and how that's impacting kind of the day to day in different um, patients that are dealing with this.
Yeah.
So I'm curious to see kind of what the longer term impact of this will be, both on the healthcare industry and then also, how the government's going to approach this type of attack. Are they going to approach it in the same manner that they did approach something like Colonial Pipeline? Is this going to have a bigger impact where, people outside of the healthcare industry are saying, hey, this is something that needs to change, even though, like you said, like a lot of people haven't heard of Change
Yeah.
Healthcare outside of the industry. So I'm really curious to see where this all goes.
I can almost sort of picture in my mind and script the, Senate hearing a month from now or 6 weeks from now, where you
Yeah.
have, unfortunate executives from Change Healthcare and probably a couple other healthcare companies just for good measure, and maybe some IT experts, and, legislators sort of pounding their fist on the table and saying, how could this have happened? How could we have let this happen? And why is every part of our healthcare system reliant on one or a handful of companies? We need to fix this, blah, blah, blah. And you can see where it's going to go. There's going to be, a bunch of, new regulations proposed, blah, blah, blah. And the medical field is already one of the most heavily regulated ones in this country anyway, especially when it comes to IT security. Like,
Yeah.
financial and medical are probably the two that I can think of off the top of my mind that have the tightest regulations. So, it's an example of the fact that anybody can get hit. And when it's something like this that's so ingrained in one specific industry, the effects can be, catastrophic is a huge word, but I think in this case, it fits, I don't think we've seen any, I haven't seen any of the breathless reports of like, oh, patients have died because of this,
Right.
I don't know that there's any way to draw a direct line to those, and I hope that certainly isn't the case. But you can almost imagine those things coming out in a week or two.
Yeah, and this is somewhat related too, but I was going back and looking at some of the filings with the SEC that Change Healthcare's parent organization had filed, and they
Yeah.
filed the 8K 2 weeks ago that initially disclosed this, and then a 10K last week, I think it was, or February 28th or something.
Hmm.
And the description of the materiality of the attack in that was really interesting to me, because they said that they have not determined yet that there will be a likely material impact. But I should probably double check on how they phrased it, because it was a very specific wording, because of all the
Yeah.
kind of legal ties into that. But I thought that was an interesting aspect to all of this too, given the all the different determinations that really go into materiality.
Yeah.
And you even beyond kind of the financial aspect of it, you've got like confidentiality, availability, integrity, and like all of these really important things are amplified when you're looking at healthcare systems because of the implication of downtime of these systems. So I thought that was a really interesting, not to get too sidetracked there, but like interesting part of all this when you're looking at the impact as well. And as we go forward, and there are going to be hearings around this, like
Oh,
I'm
yeah.
curious to see kind of how that fits into all of this.
Yeah. That whole materiality thing is such a like black hole of legalese to me. I certainly not a financial expert, but you look at that kind of stuff, and I can't think of an incident that is more material than this. I don't know what the financial impact to Change itself will be, because I don't know if they're specifically losing money. I don't know how the revenue model works, but their
Yeah.
customers are losing money, and my understanding is some patient data, or I'm sorry, customer data was stolen, or you know internal data was stolen as well. So that goes to the confidentiality part of it. So
Yeah.
um, the other aspect of this is sort of the ransomware part of it, and the BlackCat group, which I guess claimed responsibility for this and has sort of been in the news quite a lot recently. They, I guess, there were reports that they received a $22 million ransom to a wallet that experts who track this kind of stuff know is associated with BlackCat ransomware, and then other reports that the the BlackCat admins just took that money and didn't pay the affiliates who did the actual intrusion, which, you know, as you said earlier, no honor among thieves. But
Yeah.
the whole sort of, and then they sort of announced like, hey, we're shutting down. Like, that's it for us. Peace out,
Mhm.
guys. Thanks. We've had it, which probably is a good move, but maybe a little late. I have a feeling things are going to go sideways for those folks. But
Yeah.
it's always interesting to me to see how these groups, the internal dynamics and how they work. You feel like $22 million should be enough money to go around, but uh, I guess people are greedy everywhere.
Yeah. I know. And it is interesting to see kind of the back end, proceedings of all these attacks, because, and you mentioned this too, is that like it seems like at least that specific group has been targeting the healthcare more specifically, the healthcare space more specifically, whereas in
Yeah,
the past that hasn't necessarily been the case always for ransomware actors. So I mean, it's kind of disgusting to
it,
see.
it really is. I mean, I remember this quite well during the pandemic. In the early days, like in the middle of 2020, when there was a thing, as I recall, some of the ransomware groups came out and said, hey, we're not going to attack hospitals or healthcare groups or something like that. And one or two got hit by accident. I remember some decryptors being released for those, and people actually helping them out and that sort of thing. But
Mhm.
this is obviously a very targeted attack. They knew what they were doing. I mean, this is
Yeah.
what you could consider critical infrastructure, obviously, in
Yeah.
this country. And as you said, yeah, it's gross, it's disgusting, and there was just kind of, the FBI warned, I think, like a week or a few weeks or a few days ago, excuse me, about like BlackCat still being active even though there was a disruption earlier.
Hmm.
So these groups just, they don't really go away. They sort of dissipate and reform. Maybe they rebrand. Maybe they join you know, different groups for a little while or things like that. But the overall ecosystem doesn't really seem to disappear at all.
Yeah, and that's an interesting point too, Dennis, which is that like the FBI, or there was the disruption like just a couple months ago, I think it was,
Yeah,
back, was it December
it was
or something?
December. Yeah,
Yeah. And it seems like instead of, kind of laying low, like the thought process behind these people had been to, be even more brash and have this like incredibly upfront attack. So just kind of keeping that context in mind here, and kind of what that means for, kind of the ongoing back and forth between law enforcement and these types of groups, is also something, a piece in all of this as well.
yeah. I always wonder about the timing of some of these things too, because in a lot of cases, ransomware actors will be inside of a network but won't deploy the ransomware for days or weeks, or
Yeah.
sometimes even months. So it's entirely possible that they may have had access to Change Healthcare you know in January or December, even before the this disruption, and then
Hmm.
just decided to deploy the ransomware a couple weeks ago. um, but it's it's always kind of up in the air. But it does seem like we're going to continue to see fallout from this intrusion for quite a few weeks, because it doesn't look like, I know the latest update from Change said that they're in the process of rebuilding their systems, and obviously getting the patient, or the billing and payment system back online is their top priority. But those are not simple tasks. Those are not overnight things. Those are weeks out in the future, probably, for a lot of those systems. So,
Yeah.
um, you know, this is not something that's going to just disappear tomorrow afternoon.
Yeah, yeah. I mean, I'm focused, or trying to focus on kind of more long term impacts too on the healthcare industry, because this is an industry that has all these unique challenges. Not only are like smaller hospitals and providers like not well resourced at all,
Yeah.
but also they're dealing with these systems that are very kind of unique in kind of what it means for downtime for them, and what that means for patients and for doctors and the hospitals that rely on those systems. So um, I don't know if there's going to be any sort of you know uprise, I guess, of people saying like we need to better secure these systems, but that's something that I would like to see come out of all of this. So time
Yeah.
will tell.
I know it's always one of those things like whenever I go into a doctor's office and you look around and you see, the computer in the like exam room is like this Windows XP monstrosity or something like that. Or,
Yeah.
you look at like the software they're using and it's like copyright 2002. Just like, oh my God, this
Just
is what we're
thanks,
doing
Tom.
here.
Yeah.
Yeah. It doesn't fill you with confidence, but at the same time, maybe it's too old to be attacked. Nobody even knows how to attack those things anymore. I don't know. But
Yeah.
yeah, we certainly are going to see, as I said, we're going to see some, congressional hearings. We're going to see some calls for more regulation and better security standards and all of that sort of stuff. But the fact is, if things are exposed to the internet, they can get they can get compromised. So,
I know.
that's just the unfortunate reality.
Right. Right. Yeah.
Yeah. All right. Well, thanks, Lindsay. I know you'll be following this closely, and we'll look for more coverage. Thanks.
Awesome. Thanks, Dennis.
See ya.